Hamilton's COVID-19 case numbers are climbing, with no evidence they're nearing any sort of plateau or peak. The city held its first briefing on the virus of the new year, and as Matt Ingram tells us, enforcement officers were busy over the holidays, cracking down on businesses and people not following the rules.
We are not showing signs of peaking or flattening out.
At 166 cases of coronavirus per 100,000 people, Hamilton's case numbers are rising dramatically. 2 weeks ago, the case rate was 114 per 100,000 people.
We're very much still on the steep part of the curve.
Since that time, another 41 people have died, including 2 new deaths reported today, bringing the total number of dead up to 179. The city's medical officer of health, Dr. Elizabeth Richardson, says things will get worse.
We can expect to continue to see increasing case numbers, increasing numbers of outbreaks, and increasing strain on our healthcare system.
She says more people will need to go to hospitals and intensive care units. Already there are 75 people in Hamilton hospitals with COVID, including 8 in ICU at Hamilton Health Sciences.
Stay apart and stay home as much as possible.
We are not yet on top of this growing number of cases.
Emergency Operations Center Director Paul Johnson says officials were very busy over the holidays enforcing COVID-19 rules, receiving nearly 200 complaints between Christmas Eve and this past weekend. Over that same period, the city's website lists 29 charges laid against 14 businesses, and Johnson says more charges were laid against individuals.
We were also called to a number of private residences, which we do not display on our website, with house parties.
Most recently on Saturday, Johnson says a gathering to watch a sporting event was broken up at DeRosa Bakery, with people inside from different households failing to wear masks or social distance. And on New Year's Eve at Last Call Bar, Johnson says an illegal gathering was also shut down, with 5 people inside charged. Matt Ingram, CHCH News, Hamilton.